Hi, I'm Dr. Drew Digney. I'm the Site Chief for Emergency and Trauma Services here at Nanaimo Regional General Hospital. And I'm here to give you a bit of an introduction to our new emergency department that's going to be open in just a few short weeks. About 4 or 5 years ago, 70 frontline staff gathered together in a small room in the basement of the hospital here to work with a fantastic team of architects to come up with a vision for the type of building we wanted to create here in Nanaimo. So after a lot of work, a lot of thinking, a lot of scratching of heads, we actually came up with 4 key principles that we felt would represent the kind of building that we'd like to have here. And those principles were confidentiality, timeliness to care, light-filled environment, and to summarize it all, a place where people wanted to come to work. I think because of that frontline involvement, because of the incredible dedication of our staff in being involved in every aspect of the creation of this building, we've been successful. We've created an incredibly light-filled space. We have private stretcher spaces for patients to come into. Infection control has been paramount in all of the features and the design and the type of finishings that we have. And we believe we're going to be able to provide excellent, timely care for everyone that comes here. So we're very excited to be able to take you on a behind-the-scenes look. Like proud parents, this is our baby, your emergency department here in your community. Welcome. Come on in.
Hello and welcome to the new Nanaimo Emergency Department. My name is Debbie Schmidt and I'm one of the RNs working in the department currently, and I'd like to just bring you through to the check-in area and highlight some of the new things that we have. As you're walking into the emergency department, you'll notice that with just trying to enhance geriatric care that we have mobility aids close by. We have walkers right at the front door, and then as you're walking inside you'll notice that there's also going to be a bank of wheelchairs. In keeping with the geriatric population, we also have lighting and special seating available. And if you turn here, you'll notice that this is our new waiting room. This is for families and visitors that are waiting for people. Over to our side here, you'll notice the donor wall. And this is for people that have actually donated money towards the new department. There's bistro seating, and there is vending machines and handicap bathrooms. And there's also a bank of public access computers that people can use. Our information desk will be manned by volunteers that can direct people to different parts of the emergency department, but also throughout the hospital. So this is our new check-in desk, and what's new about this is that we're going to be doing what's called parallel or dual triage, and that means that there'll be a triage nurse and a registration clerk that will be checking patients in simultaneously. And so what that means for patients is that it's going to speed up the process, it's going to allow us to get information in a timely manner with less interruptions, and that the patient doesn't have to move from desk to desk. Everything can be gathered at the same time. The other thing is that we have a new electronic health record for our triage, and that means that any quality initiatives that we've been working on, such as sepsis and stroke and acute coronary syndrome, we've initiated those into our process. And we also have, the tool is a very clear and concise tool. It's really good for assessments.
My name's Gloria Bouchard. I'm the project manager for the clinical transition to our new emergency department at Nanaimo. This is Station B. We call it Blue. This is a place where patients might come if they are C-test level 3, 2, they require some blood work, they require some x-ray. We have a full x-ray unit. We have a phlebotomy station or a lab right in behind here. This is the blue area. If you're coming into emergency and you are of a lower acuity, you've hurt your wrist, you need sutures, you might come into the orange area. So this is where you would flow, child's play area. Beautiful bubble tubes are going to be bubbling here, courtyard. So this is the orange area. One of the big advantages of the orange area is that we can actually do procedural sedation right in this space. So currently if you came in with a fractured wrist and you would have an x-ray and you would wait in the queue to go over to our main acute area, you can actually have procedural sedation right in these rooms. So they are fully equipped, cardiac monitoring. You can have your procedure, have your casting, and be discharged right from within this space. This area has lots of other features, i.e. medication room, beautiful natural light. We know that medication rooms that have natural light can cut down on errors. So this one has a window. Our main medication room actually has a skylight. This space also has a 4-bed sort of alcove that will allow us to do treatment in a chair. So a patient that maybe needs a little IV, a little analgesia, can actually be treated in one of these alcoves. Otherwise, patients that flow in here will actually flow into one of the lounge sort of sitting areas, be examined by a physician and a nurse in these exam spaces, and then flow back out waiting to be reassessed. So this is ambulatory area. This space will see probably about 60% of our patients that present to our emergency department.
Hello there. My name is Darren Abbey. I'm a registered nurse and the clinical nurse educator here in the emergency department at Nanaimo Regional General Hospital. I want to welcome you to our new trauma bay. The trauma bay is located here right in front of the ambulance bay entry. So our ambulance colleagues will bring us the sickest of the sick patients and we'll receive them into this beautiful new space. Of course, some of our patients come walking in, and it's also located right beside our check-in or triage space, which is just over here. So our patients will come on in with our ambulance crew and be greeted by a team of physicians and nurses and allied health colleagues like respiratory therapy and lab and x-ray, and to meet them in this space, and we'll come and do our work. So I want to highlight a couple of things about this room. First of all, it's bright, it's large, there's natural light, and that's a huge benefit to us. It's very purpose-built, so this is really designed for the sickest of the sick, and unlike our present trauma room, it won't house inpatients, but rather, as I mentioned, when the patients come, we'll meet them here and take care of their needs, and then have some kind of disposition from here to the operating theater or to the ICU or to another center if need be. So that being said, let's take a look a bit about some of the things in the room. The room has the ability really to care for 2 patients at once in terms of pure monitoring. We could do 4 people in terms of some of the other assets like oxygen and suction and such, or we can move this equipment over to the side and use this space to do whatever we needed, for instance, stage a multi-casualty incident, for instance. So that's one of the beauties of these booms. So these booms, which normally are employed in operating theaters, we're using here in our trauma room. Really mobile, have got, again, all the sort of regular head of the bed equipment that you'd expect are all located on these booms. Beautiful full color monitors, and also the overhead lights ×2 for sort of some focused lighting should we need it. You'll notice as well there's an overhead lift here in the room to help us move patients who need that assistance. There's also will be a portable ultrasound machine in here, and both adult and pediatric crash carts with defibrillators for cardiac arrests and those kinds of cardiac emergencies. When we get into this side of the room is where we start to see some of the equipment that our respiratory therapist colleagues will help us with. So things like advanced airway carts and ventilators and such. And over here in the corner, some point-of-care testing as well coming in the near future. And that's sort of the highlights of this new space. I'd like to think that we don't get to use this room very often, and unfortunately the reality with this room is it will be used. And that being said, it's a great space, and we're looking forward to training in it. We're looking forward to working in it. It's a state-of-the-art room, and want to thank you all for your contributions that this community has made, and we're grateful to have an opportunity to work in this community and in this new department. So thank you again.
I'm Shawn Morrison, and I'm one of the clinical nurse leaders in the emergency department in Nanaimo, and I want to introduce you to our observation area or stretcher area that we now will replace the curtained area that we used to have in our old department. Just to let you know that every room in this area is an individual room, so patients will have privacy, patients that need to lie down on stretchers. This is much better for infection control reasons and also just for privacy issues. As you can see, each room has a stretcher, a bedside table, a nurse workstation in the corner, has a chair for visitors, has its own sink, its own overhead light monitors, and also overhead lifts, so that helps to assist us with care in patients who can't move on their own. One of the really nice features of this room, or all these rooms, is that we've done a lot of what we call standard work. So everything in the room will be, in every room will be in exactly the same place, so that any doctor or nurse going in will find whatever equipment they need in every single room in exactly the same spot. So that should save a lot of time. One of the other features also is a computer. We have a lot of computers on the outside of the room, so we can do work here. So eventually the nurses and doctors will do all their charting on these computers, and that will come in handy to have so many around. The other great feature is, as I said, we no longer have curtains. We have these beautiful doors that we pull across, and we can flick a switch, and this will darken out the door so that we can give private care to our patients and make it much better for them. So I just want to welcome you to this beautiful, airy, lovely environment that we get lots of sunshine, and it's a place that I really want to come and work.
Hi, I'm Carrie Mansbridge. I'm the Care Coordinator for Psychiatric Emergency Services here at Nanaimo Regional Hospital. 20% of the population in Canada will at some point in their lives be touched by mental health issues or addiction issues. What's that telling me is that we all have there's a high probability we all know somebody who is affected by this. The Psychiatric Emergency Service is a specialized unit within the emergency department to work with this specialized population. It provides support, assessment, treatment, and discharge planning in a timely way, respectful and empathetic environment. It's built with safety as one of our highest priorities. The nursing station can see the entire unit. Very little of this space is unobserved. This observation and assessment area seats approximately 12 people very comfortably. There are 2 rooms for private consultation and interviewing, and we have an outdoor space that allows people to be able to get up and walk around and burn off some of the excess energy that can happen when you're in crisis. With safety being our highest priority, we also have 2 secured rooms for those people who require that highest level of care. This area is under constant visual monitoring with video monitors, as well as being checked on frequently by the nursing staff. There are times in our lives that we may require a longer term period just to stabilize that little bit in an emergency area. And this is down this hallway are our short stay beds, or our clinical decision-making bed. So we call it the CDU. This is this area where you may have a longer-term crisis stabilization period, a longer assessment, and some risk management done. It's for stays up to 48 hours, depending on what the patient's situation is. And after everyone's discharged, once you're discharged from the CDU or from the PES area, you're followed up in the community by our community partners.
Hello, my name is Jim Morris. I'm the project manager here at the Nanaimo Regional General Hospital, and I'm pleased to be able to speak to you today about our goal for achieving LEED Gold certification. LEED stands for Leadership in Energy and Environmental Design, and we have built in a large number of sustainable features in this new facility to get us to that LEED Gold level. One of the features is behind me. What you're seeing there are solar shades that are on the exterior of the building, linked to a weather station on the roof. So as we experience heat gain within the building, the solar shades will deploy and articulate, maximizing the view, but minimizing the amount of heat gain within the building. Actually, there's so many sustainable features, and I'd love to show them to you, and most of them are in the basement, and that's where we'll go to now. So I'm standing in front of one of 3 of our fan wall systems. We're bringing in a lot of fresh air from the outside. One of the things about hospital ventilation systems is that we have to bring 100% outside air, and we exhaust 100% outside air. So as you can see, that's not on the surface very efficient. So we've tried to do everything possible we can to reduce our energy costs by making adjustments to that what starts out to be actually a very inefficient system. We have variable speed drives on these fan walls, multiple fans, so that if one goes down, the others can pick up the load. One of the real neat features here is displacement ventilation, where we're bringing high volume of air in at very low velocity. It actually is introduced to the care spaces upstairs on the floor. It finds warm bodies, floats up past and is exhausted through the roof. It's a very comfortable air system. There are no drafts. And from an energy efficiency point of view, those fans are working at much less speed than the conventional systems. So our energy savings here is in fact 54% less than a traditional building. So we're about halfway along our geothermal earth tube. Deep into the basement of the facility, we have this concrete tunnel that the supply air is now coming in over my back shoulder and is coming through this tunnel towards our fans. And along the way, we have these water tanks. Water is about 9 times more geothermically friendly than concrete is. So by using water as a medium, we're increasing that geothermal exchange. So depending on the season, we're either preheating or pre-cooling the air prior to it getting to the fans without cost, because it's not using any energy in order to to either heat or cool the air. We also have an 80,000 liter tank underneath one of our courtyards where we're collecting the backwash water from renal dialysis and using that to irrigate our landscaped areas throughout the facility. Very sustainable design. We look forward to achieving LEED Gold certification. Thank you very much.
So I hope you've enjoyed your insider's look at our new emergency department and you're as excited about the space as we are. In 2009, the Nanaimo and District Hospital Foundation agreed to raise $4 million for vitally important equipment that we need to do our jobs. Many of the members of our emergency services team have partnered with the foundation to come out and speak with you, to educate you, and encourage you to donate to this very important cause. And boy, have you come through. Thank you very much for all of your support, all of the help, and all of your kindness that you've shown in getting this project off the ground. And we in the emergency services would very much like to thank the Nanaimo and District Hospital Foundation for all the hard work they do now and will continue to do in the future. Thanks.